is our next patient, age 52. দেখি মুখেরটা। ওরাল আলসারেশন, একটু গিয়ে দেখিয়ে এসো তো সবাইকে। নাও এটা নাও। আগে কি গুটকা খেতে? হ্যাঁ, left-sided oral ulceration since last 7 to 8 years. We had seen him for back pain earlier on, discontinued because it got better, came back with this. ওইদিকে গিয়ে দেখিস। আগে কি খেতে, তামাক খেতে? Was on tobacco. This is very common in the Indian subcontinent, tobacco chewing that's result in this kind of ulcerations, which can be in many cases malignant. পেছনে গিয়ে দেখিয়ে এসো। পেছনে গিয়ে দেখিয়ে এসো। No, that was a different patient. We had another ulcer, I remember. Very difficult to heal these ulcers, to be very honest, because many times they are pre-malignant and can get quite obstinate. কি অসুবিধা হয় এটাতে? পেন, কিরকম ব্যথা? পেন while eating, pain while talking, কিরকম ব্যথা? কিরকম ব্যথা? জ্বালা করেন না? জ্বালা করে খাবার খাই যখন। Burning while eating but mostly pain while talking. Can't describe the character of pain. 7-8 বছর আছে এটা? 7 to 8 years, more on the left side. আর কি অসুবিধা হয় এটা ছাড়া? আবার কি ছোট একটা হালকা হেয়ার উঠেছে। দুটো? এক মাস হলো ছোট হালকা হেয়ার উঠেছে। কোনটা? এই যে পাশে থাকা ওই ডানটা এই সাইডে। A new lesion has come up in the last 1 month and that is making him worried. ফোনটা বন্ধ করো। এই সব জায়গায় কোনো অসুবিধা হয়? এইসব কোনো অসুবিধা নাই, হাঁ করতে অসুবিধা হয়? না স্যার, এই এটা বাড়ছে এখানে হচ্ছে। Left side, I'm asking if there is any difficulty in the corner of the mouth or difficulty to open the mouth. হাঁ করতে অসুবিধা হয় না? কতটা হাঁ হয়? Can open his mouth. You know, many times in these cases there can be oral fibrosis, you know, where the difficulty to open the mouth, not with his case. আর কি অসুবিধা? Color of the ulcer, did you see? Whitish more, right? Looks more whitish. দাঁতের কি সমস্যা হয়? দাঁতে স্যার আপনার ওই দুটো দাঁত উঠে গেছে, আবার হিলছে। Tooth decay, looseness of the teeth. ব্যথা যন্ত্রণা করে? না স্যার, ব্যথা সেরকম করে না। No pain as such. This is the major presenting complaint. গ্যাস অম্বল কি খুব বেশি হয়? সেরকম হয় না, হালকা হয়, কোনো সমস্যা। Some degree of bloating, not much. কখন হয় বেশি? খাবার খাওয়ার পরে ওই তেলটা কিছু খাই যখন। After lunch with oily food intake. ঘুম? ঘুম স্যার ঠিক আছে। Sleep is okay. টেনশন হয় তখন একটু ঘুমটা। When he is anxious because of this issue, he can become sleepless. পায়খানা? পায়খানা ঠিক আছে। Stool is regular. শীত বেশি লাগে না গরম বেশি লাগে তোমার? শীতটাই ভালো লাগে। শীত ভালো লাগে, গরম ভালো লাগে না? শীত কাতুরে, শীতে জামা কাপড় বেশি পরতে হয়? না স্যার সেরকম না। Hot, is a hot person, জল তেষ্টা? জল তেষ্টা স্বাভাবিক। Thirst average, ঘাম কিরম হয় গরমে? ঘাম হয় খুব না মোটামুটি? খুব হয়। Sweat plus, ঘামে গন্ধ হয়? শঙ্কর সুরজিৎকে ডাকতে। গন্ধ হয় ঘামে? Sweat more offensive, কোথায় ঘাম বেশি হয়? Sweat more on the upper part, offensive. খেতে কি ভালোবাসো? টক ঝাল মিষ্টি নোনতা তিতো লবণ তৈলাক্ত? প্রিয় তাও
যেটা আপনার ওই লবণ কম যুক্ত,
হ্যাঁ
লবণ কম যুক্তটাকে খাই।
নো পার্টিকুলার ফুড ডিজায়ার্স মাছ মাংস ডিম
মাছটাই খাই।
লাইকস ফিশ খাওয়া সব গরম খেতে পছন্দ ঠান্ডা
গরমে খাই।
খুব গরম না
না
মোটামুটি
মোটামুটি স্বাভাবিক স্যার।
লিউকওয়ার্ম ফুড নট টু ওয়ার্ম নট টু কোল্ড কোনো খাবার খেলে এটা বাড়ে I'm asking any food triggers the ulcer no মেজাজ কিরকম
নিজের একটু মানে হয় স্যার, একটু করা হয়।
টেম্পার ইরিটেবল কি করো রেগে গেলে
স্বাভাবিক জন্য বসে যায় বা শুয়ে যাই তখন টেম্পারটা
শাউটস চেঁচাও
একটু চেপে
ভয় কিসে লাগে
হয় কিছু।
বাইরে বলেছো কুকুরে ভয় লাগে
কুকুরে ওই যে মানে রাত্রে যদি রাখা হয় কুকুরের সঙ্গে তো ওটা ভয় হয় আমার।
ফিয়ার অফ ডগস এখনো সিগারেট খাও
একটা করে খাই।
স্মোকিং স্টিল প্রেজেন্ট ডাজন্ট chew tobacco but smoking is still there
হয়তো একটা খেলাম কিন্তু তো খেলাম এটাই।
লোকজন ভালো লাগে না একা থাকতে ইচ্ছে করে স্মরণ শক্তি কিরকম
স্যার এখন বয়স হলে রাস্তায় তো কম
ভুলে যাও
কম
ফরগেটফুল আগে পায়েটায় ব্যথা হতো ওগুলো কম আছে
কম আছে স্যার।
previously we had seen him for leg pains which are better দেখি জিভটা দেখি tongue nothing extraordinary এই জ্বালা যখন করে গরম জল ঠান্ডা জল কিছু খেলে কমে I'm asking when he has a burning
এমনিতে কমে যায়।
cold water warm water anything it improves it
না জল খেলে যে কমে যায় সেটা না, এমনি কমে যায় স্যার। জল
No.
খেলাম তো কমে যায়।
আর কিছু আগে তো বলেছিলে গরম খেলেও কমতো
হ্যাঁ
তো এখন?
সেই গরমটা আস্তে আস্তে মানে গরমটা সহ্য হচ্ছে না, এখন ঠান্ডাটাই ভালো লাগে।
তো ঠান্ডা ফ্রিজের জল
ফ্রিজ জল খায়
মুখে যখন জ্বালা করে ব্যথা করে তখন গরম কিছু মুখে দিলে ঠান্ডা কিছু দিলে তাতে কমে
না, জল খেলে ঠান্ডা জল খেলে পরে কমে যায়,
কি কমে
জ্বালাটা কমে যায়।
কমে ঠিক বলছো
মানে
নট শিওর বাট হি সেইং কি মানে
মানে জলটা যখন খেলাম তো না ঝাল লাগছে, খাবার খেলাম তো খাওয়ার সময়তে একটু ঝাল লাগছে, ওই ঝালটা জল লাগে তো জল খেয়ে তো আপনি কমে যায়।
cold water makes me better but not completely sure question mark কটা ক্লিনিক ভিজিটের বই আছে দেখে বলো এটা এগুলো নিয়ে যাও এটা ছাড়া আর কটা আছে not much symptoms to be honest I'm repeating again what we have till now age 52 left sided oral ulceration color is mostly whitish দেখি আরেকবার দেখি ঘোরাও মুখ mostly whitish pain and burning worse from eating worse from talking he has looseness of teeth with decay and blackening as well question mark better by cold application bloating worse from oily food sleepless from anxiety not often but can be strong craving for tobacco previously it was chewing it's still smoking
যেটা খোলা আছে ওটা তো কোনো আমাদের এখন অসুবিধা করে না, কিন্তু পাশেগুলো এগুলো কিনে বাড়ছে।
কোনটা
এই যে নিচেগুলো সাদা
it says the lower ones are getting whitish
বাড়েনি,
and
স্বাভাবিক থাকছে।
they are painful he's a hot person sweats more offensive forgetful with fear of dogs with anger and shouting কি কাজ করো
ব্যবসা বাণিজ্য
I'm asking profession business
Any salivation at night?
লালা পড়ে
না স্যার,
মুখে গন্ধ হয় না
না স্যার, কম নেই।
no bad breath as well মাড়ি দিয়ে রক্ত পড়া
নেই স্যার,
no bleeding gums or any blood no hemorrhage মাথা ব্যথা ঘোরা এসব কিছু নেই
না স্যার সেরকম কিছু নেই। না, নিনটা কম হয় যদি স্বাভাবিক একটু
সর্দি কাশি
নেই, নিন কম হলে একটু মাথাটা ব্যথা ব্যথা করে।
sometimes loss of sleep can cause headache when you are facing with this kind of a pre-malignant state You do not have a clear totality for a constitutional remedy. It is very very helpful to focus on few specific medicines which can help in these kind of conditions. That's why we do not have a good totality for a constitutional remedy, right? You agree?
Yeah.
Is very, what you say, it's inconsequential symptoms. First one I am thinking about is borax. White mouth ulcers. Remember, red mouth ulcers with salivation, Merxol. White mouth ulcers, borax. Borax, the color is white. White mouth ulcers, borax will respond very well. So, white mouth ulcers, but other than that, nothing else for borax, very honest. Look in the mouth section of borax, please. Mouth section, aphtha, white fungus-like growths. Mouth hot and tender. You got that? Aphtha, white fungus-like growths. Mouth hot and tender.
What about cauliflower mouth?
I will come to that, yes. You got that? White mouth ulcers, fungus-like growths. That is a good indication for borax, right? The second one, which can come up in such a case with ulceration, is Condurango, especially the oral part. Condurango. Have a look in Borike, please, for Condurango. Condurango's special action is more at the corners of the mouth. But even in oral ulceration, Condurango can do very good results. And remember, Condurango is mostly a syphilitic remedy. So, the looseness of the teeth, the decay of the teeth with the oral ulceration is more syphilitic. If you look in Condurango, please, second line, no, not second line, second paragraph. Painful cracks in the corner of the mouth is a guiding symptom of this drug. So, more cracks in the corner of the mouth for Condurango. Second line, second paragraph, chronic gastric catarrh, syphilis and cancer. So, syphilitic state, but Condurango is more this, right? Cracks in the corner of the mouth. So, if that's why I repeatedly asked him, do you have that? No. So, this area is a wonderful action for Condurango, oral and mucocutaneous junction with ulceration, especially in the corner of the mouth. But I thought of Condurango because of the syphilitic preponderance. What is the syphilitic preponderance? Teeth decay, looseness of teeth. So, there is a state of degeneration with the oral ulceration. So, here it is more syphilitic state here, and Condurango, being a syphilitic medicine, can address that as well, right. Number 1, borax, based on the look of the ulcer, white. Number 2, Condurango, A, based on location. Location where? Oral. B, based on miasm, syphilis. But symptomatically does not corroborate. Condurango's symptom is this: I can't open my mouth, cracks in the corner of the mouth. That is Condurango. But because this is the sphere of action, Condurango can come close, right. Borax, nothing very specific, I will say. It is more mixed miasmatic, but it has ulceration. So, the oral area, I will say, it is more syphilitic, right.
Craving for tobacco is a guiding symptom because it's so you shouldn't be smoking at all.
You can say, I will say that is to a certain extent syphilitic as well. It's like an addiction which takes them to the path of self-destruction.
Yeah.
So, it is syphilitic to a certain extent.
So, will tobacco help?
It does not have as such oral ulceration, to be honest. That is why I did not think of that. Number 3, another very useful medicine for oral conditions. Have a look in Borike, please, for Semper vivum, Semper, Semper vivum. Sempervivum. Sempervivum. Sempervivum is very specific for tongue cancer. But even oral cancers, sempervivum you can think of. Semper, sempervivum, Vivum. Look in the mouth section, malignant ulcers of the mouth. Everyone got that? Cancer of tongue. Tongue has ulcers. But the catch for sempervivum, my friends, remember, is hemorrhage. Hemorrhage is a very important factor for sempervivum prescription. You see, tongue has ulcers in italics, bleed easily. You got that? Bleed easily. But very good for oral ulceration as well, like here. If there was even a tinge of hemorrhage, start with sempervivum. But no hemorrhage, no sempervivum. You got that? Introduction, serous induration of the tongue, cancerous tumors. Tongue has ulcers, malignant ulcers of the mouth, bleed easily. Whole mouth very tender. So that's important for sempervivum, right? Next in this list, remember 2 Kelis who have special action in this oral area. Have a look in Sadhika mentioned Calichlor, very useful for oral ulcerations. Calichlor with Calito symptoms. Kalichlor, Calichlor. Calichlor. আগে কি এগুলো ফাটতো?
না স্যার, আমার কোনো জিনিস
এগুলো ফাটেনি তো কখনো? Calichlor, are you there?
This is tongue swollen?
No, not much. If you look in Calichlor mouth section, profuse secretion of acid saliva, white mucus surface, red tumid with grey based ulcers. So it can be whitish, greyish. Stomatitis, aphthous and gangrenous, fetor, mercurial stomatitis as a mouthwash. So you can use Calichlor as a mouthwash as well, 3x, 6x. You can use it as a mouthwash, but you can use it in 30C, 200C as well. Greyish ulceration with bad breath, with acrid saliva. And some Kali features like the weakness of Kali, the backache of Kali. If that goes hand in hand, then Calichlor is a good enough remedy.
He had backache in history.
Yeah, in the past. True. You're with me? Greyish ulcerations with bad breath, with acrid salivation. With some Kali symptoms in the background, which can be backache, which can be weakness. That's about your Calichlor. The last Kali in that list, to finish up, just the next medicine after Calichlor, Kali-cyanatum. Kali-cyanatum is potassium cyanide. When you have an ulcer in the oral cavity, especially in the tongue, and the patient is unable to speak along with that, that is where Kali-cyanatum will help you. Where is it mentioned? Tongue. Ulcer of the tongue with indurated edges, power of speech lost but intelligence intact. So much is the ulceration that he is unable to speak, and with that exhaustion goes hand in hand for Kali-cyanatum. And the modality is interesting for Kali-cyan. If you see 4 AM to 4 PM, so more early morning daytime aggravation for Kali-cyanatum. Early morning daytime. $30C for Kali-cyanatum. জল তেষ্টা কিরকম? বেশি না স্বাভাবিক?
স্বাভাবিক।
ঘাম খুব বেশি হয় না মোটামুটি?
ঘাম গরমের সময় তো হয়, এমনির সময় তো হয় না স্যার। গরমের সময় তো ঘুমটা হয়।
I'm thinking of mercury as well, merc, ulceration, teeth decay, offensiveness of sweat, right? Teeth decay, offensiveness of sweat. ulceration. দাঁতগুলো কি কালো হয়ে গেছে?
Irritable temper.
And syphilitic. Likes smoking, but it knows it kills him. If you look at the teeth, not in context, দেখা জিভটা করো lot of blackening at the roots. This you can find very often with Staphylococcus. In a patient who smokes quite a lot, Staphylococcus is extreme craving for tobacco, with blackening at the edges and at the sides of the teeth. So Staphylococcus doesn't come in here, to be honest, but if you're dealing just with dental issues with lot of blackening in a patient who has strong tobacco craving, Staphylococcus is a good tooth medicine, right? So lot of blackening of the teeth you can find with staph. Creosote will have hemorrhage more, but hemorrhage, bleeding is important for creosote.
What did you give him last? Or this your first?
I had seen him back in 2024 for back pain. Bryonia was prescribed and Rastox. There was a history of injury, and he came for 2 or 3 times, gone.
And he didn't mention his mouth ulcer at that point.
Sorry?
He didn't mention
No, because that was troubling him at that point of time. I'll go for a Merck salt today. 200C. Reasons of Merck salt: ulceration syphilitic, decay of teeth syphilitic, burning pains are syphilitic, with offensive sweats and profuse sweats. Not a good totality, but still let's start with a syphilitic remedy, to help the case. Let's start with a syphilitic remedy. Few remedies which you can use locally as a mouthwash. One is calichlor, I shared that with you, locally as a mouthwash with these kind of ulceration, calichlor in 3x or 6x. Number 2, Ratania. Ratania works wonderfully as a mouthwash for cases of oral ulceration. Ratania, Ratania, this is mentioned in Clark's dictionary. Ratania as a mouthwash, you won't find it in Borike. Ratania as a mouthwash for oral ulceration, especially if there is splinter or burning like pain. Ratania, Ratania, Ratania as a mouthwash for oral ulceration. Number 3, as a mouthwash for oral ulceration, what is the name of the remedy? Calotropis, Calotropis, Calotropis. I'm talking about just organopathics for mouthwash. Calotropis, Calotropis. Calotropis is a syphilitic remedy which also has lot of oral ulceration. You can use it locally in tincture for mouthwash. You with me? Calotropis. Calotropis is a syphilitic remedy for oral ulceration. And obviously our good old calendula. Calendula can also be used in tincture as a mouthwash for oral ulceration. I repeat again, calichlor in 3x and 6x if it's a greyish white ulceration. Ratania if there is a lot of burning or splinter like pains with the ulceration, right? Calotropis is just a syphilitic medicine, so more oral ulceration with lot of syphilitic symptoms. Calotropis and calendula, if you don't have anything else, just go with calendula. I'm giving him calichlor to mouthwash locally. Calichlor has more greyish white and that can help. Repeating the points of Merck salt again today: syphilitic state with burning, with ulceration, syphilitic with tooth decay, and in a patient who has offensive profuse perspiration. 200 C for Marxol. Just to finish up that list of tongue cancers, there's another medicine I just came up in my mind. Have a look in Borike, please. Gallium, G-A-L-I-U-M, Gallium app, G-A-L-I-U-M, Gallium app. When you have oral ulceration or tongue cancer or oral cancer with lot of induration, you know, there's a lot of swelling in the oral cavity. Lot of induration, swelling in the oral cavity. This one for him, still it's, I will say it's not malignant right now, I will say it's pre-malignant, but hopefully, you know, many cases we have reversed it, but it's obstinate, it takes a lot of time, you know, perhaps one remedy won't do it, you know, we need to chop and change, and perhaps, you know, based on presenting symptoms we need different remedies later on, but this can be done. But you know, sometimes it has spread to the entire oral cavity, you can't do much, it's just, you know, preventing further progress. But this I will say is still early, pre-malignant stages, we can revert it. And conventional treatment, you know, is very invasive, you know, they will ask to cut off the entire area. I don't want to do that. Gallium, anyone got it? Gallium.
Has clinical confirmation of the use in cancerous ulcers and nodulated
What else?
tumours of the tongue.
Clinical confirmation using cancerous ulcers, nodulated tumors of the tongue. You see, favors healthy granulation on ulcerated surfaces. This is also a useful medicine. You know, these kind of ulcerations, it can help. It helps in promoting growth, normal growth on ulcers. So, gallium can also help in such cases. Especially my understanding of gallium is more nodules, you know, have formed, you know, like nodules on the tongue have formed. But you understand it works in a way so that the ulceration is reversed, healthy granulation tissue again develops, much like calendula to a certain extent. But its only action is this, oral, 30, 200 for gallium app.